Welcome to another episode of the brand called You, a podcast and podcast show that brings you leadership lessons, knowledge, experience, and wisdom from thousands of successful individuals from around the world. I am your host, Ashutosh Garg, and today I'm privileged to welcome a very accomplished and respected medical doctor from Pune, India, and also from the US, Dr. Nandan Yardi. Dr. Yardi, welcome to the show.
Thank you for this kind invitation, and it's my honor to be on your show. I know you've done many such shows, and it's a very good initiative where you reach out to tens of thousands of people all over the world. So it's a great pleasure
Thank
for
you.
me to be on your show.
Thank you, Doc. Dr. Yardi is the partner and owner of the Vatsal Yardi Hospital. He is a member of the Publications Council of the International League Against Epilepsy. He's an editor-in-chief of the ILAE Wikipedia Epilepsy Initiative. He's a senior consultant, associate professor of pediatrics, pediatric neurology, and childhood and adult epileptologist. He's published several papers, and given the kind of work he has been doing, he's understandably been recognized and felicitated several times. So, Doc, before we talk epilepsy, tell me about your journey and what got you interested to focus on epilepsy.
Basically, I was doing medicine in Pune in the BJ Medical College. And when I started doing my MD pediatrics, we have to do a thesis on a particular topic. And the topic I chose at that time was epilepsy, childhood epilepsy. And then there was a challenge that was thrown at me by our departmental head that there is going to be a high performance liquid chromatography machine that they're acquiring in the next 2 months as you begin your term. And we would like you to use that machine in your epilepsy interest. So then I started working on that and found that there were a couple of drugs, 4 drugs available in those days. This was 1984, and there were just 4 medications available for epilepsy, and we needed to measure the level of the drugs in a patient's blood to know how much drug is going in the body and whether it's effective or whether it's causing side effects because of high levels or not causing enough control of seizures because of low levels. So this was kind of a question that I had. And then I went around for almost a year going to NCL and so many other places around the country where people are using HPLC. And nobody was using HPLC on biologic samples because they have to clog the carbon column that is used to separate these entities from blood. And so I went around 1 year and didn't find a solution. And then eventually we found a method which is known as acyl acetate extraction. And we were able to separate all the plasma and the serum from the blood. And then we got a very clear fluid that would not coagulate a column. So eventually, to cut the long story short, that's where I began my twist into epilepsy. I finished my MD. And then several years later, I started practicing as a pediatrician with an interest in epilepsy. And then this kind of thing that we had looked on epilepsy on the HPLC, same question was being addressed around the world. So 2 German epileptologists looked at the study, and they actually invited me because they said, we tried doing this and we were not able to do it the way you have done it. So that's where I got some international exposure. I got my training in Germany in Bielefeld with Professor Peter Wolf. And then subsequently others in Swiss Epilepsy Center, then Maudsley in UK, and then eventually there was a tie-up between the Bethel and Cleveland Clinic. So I went to Cleveland Clinic in 2007 as a visiting international fellow and acquired more and more knowledge and training working with all the stalwarts. And that's how I have progressed. I got introduced to the International League Against Epilepsy, which is about represented by about more than 120 countries with scientists working and researchers working on that, doctors working on that for betterment of lives of epilepsy. And then I've been involved with the ILA since 1993 on various commissions. And currently I'm at the Publications Council.
Amazing.
Wikipedia as the chief editor-in-chief for the epilepsy section and all that.
Amazing. What an amazing journey you've had. Thank you for sharing it. So, Doc, tell me a little bit about epilepsy and how does it differ from other kinds of occasional seizures?
Right. So epilepsy is a condition where a person has sudden excessive abnormal discharges from the brain. We know that our brain has got electrical activity, which is based on certain chemicals. There are 2 types of chemicals, those that excite the brain and the second neurotransmitters, the chemicals and neurotransmitters that suppress the brain. And whenever there's an imbalance between these two groups, there is an excessive excitation or a reduced inhibition. So either ways, the brain gets excited, and that causes impairment of brain function, either by loss of consciousness or by jerking or, tongue bite, clenching teeth, loss of control of urine and stool, and so many things that we know about. But when somebody gets a single seizure, it may be because of the environment. Say a person is dehydrated, out in the sun, got a sunstroke. So these are situational seizures. We don't label it as epilepsy. But when there are more than two unprovoked seizures, or if there's a single seizure with some abnormality in, say, brain MRI or something, which is telling us that this patient is now likely to get more seizures, then we label it as epilepsy. And there are varieties of epilepsies that are there. The one we know is there where a person cries, falls down, clenches his teeth, jerks his limb. But there are about 20, 30 different presentations of this, where, for example, a child may just go blank for a few seconds and then get back into his surroundings. These are known as absence attacks, very likely to be missed, but sometimes teachers or parents pick it up and it can be very easily treated. So there's a whole variety of spectrum. Now, epilepsy is one of the things that has many underlying causes. And we have to delve into all that and find out what is the root cause of it. Right?
Very interesting. And Doc, what are some of the common misconceptions about epilepsy?
Oh, this is one of the conditions which has got very severe stigma, even today, not only in the developing countries, but also in the developed world. Now, this is because mainly of ignorance, lack of literacy, poverty, lack of access to knowledge and to treatments, and therefore, these variety of myths. I mean, I could go on and on and on about the myths, but a lot of people, say in Africa, thought that it is if you come in contact with the spit of a person, you will get epilepsy. If you go close to a fire, you will get epilepsy. If you go close to a water body, you get epilepsy, and so on and so forth. Then people believe that it's because of demons or gods and curses and wraths. So all that was there and still persistent, especially in the tribal area, but not only tribal, even sometimes in developed countries.
Very interesting. And how does epilepsy in children differ from that in adults?
Epilepsy is commonest in children. The biggest peak of epilepsy is seen in children, possibly because they have abnormalities at the time of birth in terms of having difficult deliveries. After delivery, the very common cause in developing countries, the child is not fed properly, so they get a drop in sugar, which is known as hypoglycemia. That hypoglycemia can lead to severe brain injury and cause seizures right from the childhood. Then there are brain infections, and children are exposed to many things, and therefore the highest peak is in children. Then the new onset epilepsy between 20 to 40 years is relatively uncommon. And then as we age from 45 or 50 onwards into senior citizenship, then there are changes in the body that have occurred because of atherosclerosis and other things. And that's where, again, there's a smaller peak that comes up. So to the children, epilepsy is a lot based on genetics, a lot based on, birth history and so on and so forth. The good part is children are very amenable to treatment, either medically with medication, and they respond very well, much better than adults. And if you, now we talk of epilepsy surgery in children, the outcome of epilepsy surgery in children is much, much better than those in adults. So there's a very positive thing to diagnose epilepsy early in children and offer them the correct treatment, and they will do fairly or very well in life.
Very informative answer. Thank you, Doc. My next question is that how does epilepsy affect a person's lifestyle? And what can people do to manage epilepsy better?
It affects a person's quality of life to a great extent. Once a patient is told that he has epilepsy, it's as if, some doom has come on him and also the family, immediate family, and sometimes extended family. And this is because there is suddenly this stigma and a lot of misunderstanding, which everybody wants him to be protected, not go to, for if it's a child, not go to school, not go to play, don't go near water, no swimming, no driving for an adult. And this can really impact the quality of life. So it really affects the quality of life. However, with proper treatment, all this can be taken care of. And more than treatment, we will discuss maybe sometime later that the caregivers have an important role to take care of this patient and provide help. And that really then they can do almost everything. we have had great people on this earth who had epilepsy at the times when treatment were not available, like Julius Caesar, Napoleon Bonaparte, uh, and so many other philosophers like Dostoevsky, painters, Charles Dickens, so many people. And when in the days when treatment were not available, they did pretty well. Now with all modern treatment and good knowledge of epilepsy, which we are actually fighting for, we want to get people to understand and have all the knowledge about epilepsy so they can deal with it better. So that way, really a person who has epilepsy should not fear it. He should take care of it and lead a normal life, as near normal as possible. Of course, there is a scope. All people have that seizure worry. When am I going to get the next seizure? And that's one of the major determinants. So if you can give them good knowledge, if you can give them protection, tell them it's important to take the medications on time without missing doses, and then their seizure will come down and the quality of life will be much, much better.
Very interesting. And since you just spoke about caregivers, let me ask you the question. What advice would you give to caregivers of epilepsy patients?
See, caregivers have a very important role. They have to make sure, as I said, that regular compliance with medication has to be done. They could help with keeping appointments, taking them to the doctor for visits, making sure the person with epilepsy may or may not be completely aware of all these things or may not be able to manage all this. So it clearly needs help from immediate family or caregivers. And of course, the caregiver should learn about the condition, get maximum knowledge about epilepsy as possible. They should impart this knowledge to others in, say, support groups and form networks of family and friends, all of which is going to be helpful to their patient.
Right.
And they should also be told how to take care of seizures. If a seizure occurs at home, what first aid to do. A lot of, again, misconceptions are there. You give them some iron thing, or make them smell a shoe or a chappal or something like that. All those misconceptions should be gotten rid of to the caregiver's knowledge. And then they can use some very simple nasal sprays that can be used at home to stop the seizures. So they don't have to rush to hospital and all those things. So they have a very, very important role.
Very important. Well said. And Doc, are there any major challenges in diagnosing epilepsy?
See, diagnosing epilepsy, the biggest challenge is that patients don't come forward with, and never came forward in so many years. But now with all the dissipation of knowledge that various NGOs such as the ILAE, the International Bureau of Epilepsy, and so many other, patient groups are doing, advocacy is going on. With that, the knowledge is increasing and people are coming forward with their problem. In the olden time, they would hide this because the person couldn't go to school, the girls couldn't get married, they couldn't, they had a lot of restrictions because of the stigma of it. So this is the biggest challenge in diagnosis. And because of that challenge and because of ignorance in epilepsy, there's a large treatment gap. Almost 80% of the patients with epilepsy do not come forward for treatment, or even if they know that they have epilepsy, do not have access to treatment. So the International League, along with WHO, has partnered, and they are trying to solve this with what is now known as what was known as a global campaign against epilepsy, bringing epilepsy out of the shadows. Now that has turned into an intersectoral IGAP, which is to do with at least 90% of the patients should be diagnosed, 80% should have access to treatment, and 70% of them then would respond and be completely controlled of seizures to lead a normal life. So that is that. And we have sort of sown the seeds of this, because at 95, I got an ILA Educational Award, and we did a knowledge, attitude, and practice study in Western Maharashtra going down to tribal levels and even to tribal levels. Schools, school teachers, paramedical workers, medical students, we looked at the knowledge, attitude, and practice about epilepsy, all these. And this was, I had done this work with the help of Tropical Institute of Neurology at Limoges. And then we found that there were gaps. We presented this to the WHO ILA meeting in Geneva in 96. In 97, the WHO global campaign was born, and now that has today led to the intersectoral IGAP. So there's a huge community working for it, and hopefully in the next, by 2030, we will achieve this 90, 80, 70% with everybody's help.
Oh, amazing. Thank you. You were telling me a few minutes back about Julius Caesar and Napoleon and other very, very well-known people. Today, epilepsy has the advantage of technology.
Right.
My question to you is, how is technology changing the treatment of epilepsy?
See, once the treatment of epilepsy sort of came in, the initial medications were bromide and then phenobarbital. That was way back in the early 20th centuries, in 1912 or thereabouts. And then from there, at least 25 new medicines have been sort of discovered, and more are being discovered with the advent of looking for various targets that cause epilepsy. So cell membranes have got certain gates, and these gates are manned by sodium and potassium and so many other molecules. And basically targeting and finding these gates being responsible for getting excitability of neurons. They have done neurobiological studies and found various drugs. So about 25 drugs are there.
Right.
So far, these drugs were anti-seizure medications. They would stop the excitation and seizures, right? And still, in spite of these 25 very good discoveries, of which I have been a principal investigator for US FDA for at least 7 of the last molecules, and that's why they were available to the whole world.
Right.
So our research has helped that. And then with this, what happens? There's still a 30% of population of epilepsy that is resistant to treatment. Now the trend is changing from trying to treat seizures to trying to prevent epilepsy and trying to find the sort of biomarkers that tell us what is causing that epilepsy and trying to target those. So now we are moving towards targeted treatment. So once you find the target of a particular subgroup of epilepsy, and as you can see, we now don't call it epilepsy, we call it epilepsies. And that underscores the fact that it is a huge compendium of various things that are grouped under epilepsies. So there are small groups which have got very specific biomarkers which we are finding. And then we are finding drugs that will target those biomarkers to improve the quality and even prevent further progression. So from treating seizures and just trying to stop seizures, actually trying to find the root cause and trying to prevent epilepsy is the big challenge. Genetics has come in a big way into it. And one of the biomarkers, which is electrophysiological, which actually tells us that an epileptic attack is going to occur very soon, is what is known as a high frequency oscillation of discharges in the neurons. And this can be measured, right? So HFO, and one of my students whom I was guiding for PhD actually did work on HFO detection using, machine learning and AI. And we have published that paper in IEEE. And now this technology, and various other people have also worked on this, but this technology then can be used in wearables. And these wearables, if given to a patient, will detect seizures and other changes in the body. To warn either the caregiver, so message can go to caregiver, to the doctor, and also an indication to the patient, where he can take some medication, a pop a pill, or somebody gives him a spray and the seizure stops. So preventive things can be very well, helped with technology.
Very interesting.
In terms of surgery, if I may, in terms of epilepsy surgery, which is possible in 10 to 15% of patients who has a discrete sort of focus in the brain, which can be removed, and it's almost curative in these. A lot of technology has come in, like MRI. Then there's a functional MRI that looks at the brain function, like speech and motor areas. Then there's a positive emission tomography, PET scan. Then the SPECT scan, and all those things. And also we can find the brain tracks by tractography. So all these can be used to actually delineate a very nice focus. And then either that focus can be surgically removed or ablated by laser, or the brain can be neuromodulated using certain equipment. And this is the real advance of technology. And the last but not the least is all the data using AI, which is useful for early detection and diagnosis, and therefore early treatment leading to good outcomes. It's all mind-boggling. And we've just set up a neurotechnology section in the International League Against Epilepsy, and we have about 460 members already within a month. Wow. And these are all basic researchers, scientists, along with clinicians who are going to be working in this space in the near future. So we just did this in September. We started in September. We have 460 members already. Wow. So it's very exciting times for us. And let's see how it helps. The technology surely will change.
And everything that you do is going to benefit thousands and thousands of patients around the
There are
world.
about
So
70 million people around the world with epilepsy. So
amazing.
it's seen in 1 in 200 people. So,
Yeah.
and the number of families that are affected are even a large number of people, because indirectly they're affected in terms of
Correct.
quality of life, cost, and every other thing.
Correct. Absolutely. So, Doc, I have time for two more questions. My next question, and when I was preparing for my conversation with you, I seem to have picked up that there could be an intersection between epilepsy and mental health challenges. I'd love to get your perspective on this.
That's a very lovely question, actually. And it was not really, it was recognized in the past that there was some relation between mental health and epilepsy. And there was a kind of stamping that epilepsy is a kind of mental health problem, which it is not, as we see, right? And this is one of the big stigmas that people have in declaring that they have epilepsy, because they're equated with insanity. And even in the Indian laws, the marriage law, had equated, epilepsy and mental illness, and was a legal ground for divorce.
Oh, okay.
So the Indian Epilepsy Association, with Professor K.S., led by Professor K.S. Mani from Bangalore, and the entire team from the Indian Epilepsy Association in India, have fought for nearly 25 years for this. And they got the law repealed because it was an anarchic British time law. And so you're right in having this sort of, kind of asking this question. But if you look at the science of this, they do have some comorbidity. People with epilepsy mostly do not have mental illness.
Okay.
But in children, you might have up to 30 or 40% having some other minor comorbidity, which may not be mental illness as such, but they could be attention deficit hyperactivity, some autistic features, sometimes depression, anxiety because of seizures and other things. And in the adults, the chances of depression are about 20 to 30%. There could be some other psychiatric disorders associated, because everything is to do with the brain. They, of course, have seizure, worry, and anxiety. So there is an overlap, but it is not equated. Not everybody has it. You might have 70, 80% of the people who are completely fine, maybe more than that. And when you start hunting for these signs, you might find 20, 30%, scatter of some mental illness which is associated, which has to be taken into account and treated as such. Sometimes if you treat the epilepsy properly, seizures go away. A lot of burden of mental illness and anxiety and all that is also taken away. So a good treatment of epilepsy often can, reverse this.
Very interesting. And my last question to you, Doc. You only told me about the amazing work that ILAE is doing and on all the papers that you are working on and reading on. What are the future directions in epilepsy research and treatment? And you just told me that 1 in 200 people in the world could be faced with epilepsy.
Right. So again, I would like to say that it is really preventive medicine in terms of, preventing epilepsy, which will go a long way. Because as the world population is increasing, we're going to have more and more. It was 50 million sometime back. In the recent thing, they're about 70 million. It can go on to 80, 90, 100 million, which is a significant amount of people. So prevention is the best thing to do. A lot of developing countries need access to care, need knowledge about how to prevent the causes. I'll give you an example that children are not fed on breast for the first 2 days in many of the nursing homes, leading to till the breast milk starts, and leading to hypoglycemia and very severe brain damage, which will devastate the baby in terms of visual loss and cerebral palsy and seizures. And this is a real burden to the society and to the countries and all over the world. So it's basically preventive, number one. Second thing is a lot of genetic testing is going on now to delineate those small group of genetic epilepsies, which can then be the parents can be counseled for the next child, and this can be prevented. And also, the individual patient, if he has a certain genetic sort of marker, there are efforts to target that marker and make changes. Just like we had the COVID vaccines where adenovirus was injected with the genetic material and it went into the body cells and created proteins. Similarly, gene tests are going, so research is going on these things, where you can actually inject something and you can create proteins which were missing, which was causing the epilepsy. So you're able to provide those proteins by genetic techniques. So that's really is the future prevention of epilepsy. and then using technology to sort of, sometimes treat some of those targeted. And the basket of targeted treatments is surely growing in the last few years. So we have exciting times ahead, and hope we will be here to see all those changes in the next 10 years and reach out to people, to the most mofussil areas where access to care, access to medication, which is also difficult in certain parts of, say, Sub-Saharan example.
Very true.
Large regions having no diagnostic facilities, just one CT scan in a huge Sub-Saharan African region is really a shame, I think the whole community is working towards that.
Very true. Very true. And Doc, on that note, I just want to say thank you so much for speaking to me. Thank you for talking to me about your own journey. Thank you for talking to me about epilepsy at such length. I mean, all of us who are not medical professionals have all kinds of misconceptions about epilepsy. And thank you so much for clarifying a lot of these to the thousands and thousands of people who will listen to our conversation. I learned many new things about epilepsy. Thank you for all the amazing work that you're doing to cure and hopefully predict sooner than later challenges that something like epilepsy, which is, and as you say, very, very manageable. Thank you for all the great work that you and a lot of your other colleagues are doing. Thank you.
It's been a great pleasure. Just want to add one thing, that with the ILA Wikipedia Epilepsy Project, we have had about 4.5 million hits on the articles on epilepsy. And it's now my duty to give contemporary knowledge to people on Wikipedia so that it reaches the most remotest part of the people. Very easily, people can use it on their cell phones or wherever they can go and get the correct knowledge. And that's what we are working towards right now. So thank you very much. It's been a pleasure.
Thank you, Doctor. Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.